And Sharon, if you don't know, was a leader in helping establish with Bill Dement the sort of mothership of a lot of sleep medicine around the world, the Stanford Sleep Residency Program. And also she was instrumental in helping create the profession of sleep technologists around the world, amongst many other things. She's she's still at Stanford, and she also has the Palo Alto School of Sleep Medicine. And while she's pulling up her presentation, I want to give a shout out to Dr. Esther Bianchini, who, when I was mentioning people who are great mentors and friends and inspirations from Brazil, I didn't want to leave her out. So thank you, Dr. Keenan.
Thank you, Mark, for that very kind and generous introduction. I am equally honored to be here with this august group. And it is true, we have been working hard on collaboration, and I have tremendous hope for the potential of the work of the group of the people in this field. Dr. Carstensen, thank you so much for your enthusiasm around these things and for the points that you bring to our service. We look forward to working together in wonderful collaboration. I'm going to be quick because I know we're running over time a little bit and we're getting to opening ceremonies. So I may skip through a few things, but I just want to start with context. These are NASA images, and here we are. Here we are in this room today all together. But here we are, Mercury, Venus, Earth, with our friendly moon, Venus. The rest of the group is there. These are wonderful images from NASA. I'm not going to take more time on that other than to say, here is our beautiful, wonderful Earth, and our responsibility to recognize our place on the face of the planet as human organisms, as biological organisms. We are here by some design of some intelligence that's certainly greater than any one of us sitting in the room. And our good friend the moon has tremendous impact on our daily experience as well. The bright and shining star in the universe, for many of us, is Dr. Guilleminault. And I'll say a few things, but I must say he has been channeling all day a few comments. Particularly the first one is about the total reliance on AHI. I could not speak and not mention this. We cannot rely simply on these numbers to dictate our choices and behaviors in clinical practice. Most important, I think we have embraced certain tools or numbers that give us a certain sense of confidence about how we move forward in our clinical practice. It's critical. I'm the sleep person in this group. I'm not a dentist. I'm not a myofunctional therapist. I'm not any one of the wonderful skills that you bring to this group. I'm a sleep person, and I have been trained by Dr. Guilleminault since my childhood. And Guilleminault would say, please, 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 let's not forget the brain. And you know of his work with the upper airway resistance syndrome. That was a term that was given to what we were seeing in the lab, where people were coming in with complaints of fatigue and inability to function on their daily basis. And when we looked at the findings from the sleep laboratory, our most important variable is the brain. And the upper airway resistance description came from the recognition of these repetitive, intermittent arousals that would occur throughout the sleep studies. But if you looked at the breathing channels, there were no apneas. There were no frank hypopneas. There was absence of oxygen desaturation. There was absence of change in cardiac rhythm. The only thing that was happening was these intermittent discontinuation of the process of sleep, this lack of consolidation, this lack of ability to continue this period, this sacred time that our brain allows for the further development of the central nervous system, maintenance of bodily function. The point I'm trying to make is that we have to go beyond or even our current variables that we use in sleep medicine. We have to increase our ability to look closely at the brain through sleep and wakefulness. We have to recognize that this brilliant period of consolidated, continuous sleep does wonderful things for the entire body. And we must continue to elicit and to bring in the work and the insights of people all around us from every specialty in medicine. Sleep medicine started in the 60s. There's a long history of neurology. There's a long history of pulmonary medicine. I could go down a rabbit hole and we won't. But Christian Guilleminault is very important in terms of bringing lots of disparate and various groups of people with expertise together. The other important piece that he asked me, again, sorry, that's weird, but I feel this way about him. I think he's on a different channel. He has not left. He's on a different channel, and we have lots of ways of communicating. The other important thing is to keep in mind that with children, we don't always see the dramatic changes in oxygen saturation that we have been used to relying on in the adult population to help us index severity. We know that kids, because of how they are organized and their lungs at that point in time, are much more likely in the sleep laboratory to show changes in carbon dioxide and not so dramatically the changes in oxygen saturation. So that's an important piece, and we've talked about oxygen saturation today, but we haven't really talked a lot about carbon dioxide. The other critical piece that was coming throughout the course of the day is, again, I've got my sleep hat on, so I am saying to you, please, please, I think it's brilliant, this group that's coming together. The dentists are seeing the kids once a year. I mean, this is 60% of the kids. This is music to the ears of those of us who know so many kids that are struggling. So it is critical that we continue in the vein of working collaboratively. I lost my train of thought for some reason. So oh, I got it now. The reason, thank God I made a note. The reason is that because we are focused on breathing and because we are focused on function and anatomy and structure and the relationship among all of those things, it's important to recognize that, yes, in sleep medicine, 80% of the people that we see in the sleep clinic are people who present with sleep-related breathing disorders. It's important for you to remember that the largest group of people who suffer from complaints about sleep are patients who complain of insomnia. We don't see the insomnia patients in the sleep laboratory usually because those studies are not paid for in the US. So we have a mismatch between the services that we bring to different kinds of complaints that any person suffering from sleep disorders. Obstructive sleep apnea is very common. Insomnia is even more common. People can complain of both. Narcolepsy has roughly the same incidence as multiple sclerosis. People have aches and pains in their body that interfere with their sleep. If you also suffer from apnea, as well as any of the other 85 sleep disorders that are in the International Classification of Sleep Disorders, you are going to suffer tremendously. You will not be able to function throughout the course of the day. You will not be able to rise to the greatest levels of your potential. So I want to go through what he said. He said to the fellows at the center before he left, you are the future of the field. You have to take risks. You have to think. You have to question. You have to challenge. Please see the children. Help the mothers. Consider the family. Move with no fear. And he would always tell us, even when we resisted, you know, Christian, we cannot move these machines from here to there. Challenging things that came up in the clinical environment, his response was, you can do it. That was always his response, would not take no. CG was always at the lab, in the lab, and often, you know, we've talked about him, and in one of the events that was hosted, we were reminded of the wonderful, beautiful poet, the French Apollinaire, that came and said, was giving the story about the master. And the master who said to the group, come to the edge. 10 minutes, I can do it, Okay, 10 minutes, come to the edge, he said, come to the edge. And the group said, no, we're afraid to come to the edge. And they came to the edge finally after he coerced and pushed and shoved, and they came to the edge. And then he pushed them, and they flew. So I am asking you to keep in mind this kind of motivation. And there's also the concept that if you are not living on the edge, perhaps you're taking up too much room. I mean, that was on a postcard. Alarm clocks. How many people in the room use alarm clocks? Okay, it's a very common thing. How many of you have the experience on a pretty regular basis that you wake up just 1 or 2 minutes before your alarm clock? Right? You guys are the wonderful sleepers. That was a spontaneous awakening. You should delight in the realization that your brain came to arousal before your alarm clock went off. That is the most important sign and signal that you got sufficient sleep at the right time. Right? It's a wonderful, beautiful signal that you're doing something right. And alarm clocks, anyway, we're not going to talk more about alarm clocks. Sleep, sleep deprivation. These are signs and symptoms of sleep deprivation, widely, available in the literature. There's no debate about this long list of things I'm not going to discuss, but one thing I want to draw your attention to is that with sleep deprivation, regardless of where it comes from, whether it's problems with breathing, or that you move too much, or that you have a poor environment, or that you don't feel safe, or that you have a noisy co-sleeper, all these sorts of things can interfere with your sleep. That kind of even lack of physical pathology sort of deprivation can lead directly to impaired attention. And what we have is a world that has a business model that many of the big companies, their primary goal is to get your attention, is to get your attention. And if you're working with sleep deprivation, it makes life even that much more difficult. We certainly can experience apathy and a decreased tolerance for frustration. It's difficult to be kind. You lose your sense of humor. And certainly we have diminished capacity for empathy. How can we rise to the occasion to care about the other if we are already suffering from this dramatic weight that is sleep deprivation? Most folks are time-starved and sleep-deprived. And insufficient sleep in the worst case set of circumstances can be demonstrated by this study, this important study that was done by Lee, published in Sleep, looking at suicidality in adolescents. We know that sleep deprivation and emotional disturbances go hand in hand. We know that the pressures of kids in school these days are tremendous. And we are the only species on the face of the planet that engages in behaviorally induced insufficient sleep. We are the only species that that we choose to sleep deprive ourselves. There's behaviors with the elephants, for example, the moms moving the babies at night to protect them. But we're the only species that electively sleep deprives ourselves. And we do this, and we actually approve of it in our adolescent population. For example, we know the typical pattern of short sleep throughout the week and then catching up on the weekends. We would not use this kind of mentality with our kids if we were talking about eating. Oh, we're only going to feed you a little bit all during the week, but you can eat all you want during the weekend. It would be crazy making. We wouldn't think about that. So the National Sleep Foundation is a wonderful organization that has done systematically every year Gallup polls on sleep. These data are available to anyone who wants them, to any way that are helpful to you in your own local environments. In 2001, they looked at the impact of not getting enough sleep. And those that reported that when they do get less than what they know that they should, 94% of the people report that there's problems. And you can see that there's high percentages with a long list of things that go wrong when you don't get enough sleep. Kids are now looked at the potential human capital value. So there's competition to get into the right preschool, the right kindergarten, the right whatever, to be able to set them up to maximize their potential to gain economic strength in their own environment. We know that the ADHD is a very prevalent attention deficit hyperactivity disorder, is highly prevalent and growing in numbers. And in fact, it's a label that is given to a constellation of symptomatology that we have seen for years, and the labels have changed for the behavior. Clinically, we treat attention deficit hyperactivity disorder by administering stimulants, and they work. Kids are happy, parents are happy, teachers are happy, outcomes are better in terms of ability to focus, but there's not necessarily substantial evidence to prove that stimulants improve cognitive function. They make you feel as if you're performing at high levels. And the fact that stimulants work, and you ask the clinicians, why do the stimulants work? They scratch their head as a clinician and say, we don't know, but it works, so we keep on doing. It's standard of care. If we ask people in our own sleep community, like Ron Shervin and our other dedicated pediatric clinicians, we know that stimulants will work in this group because many data, lots of data, show that the children, of course, are sleep deprived. If we gave a little bit of Ritalin to everyone in the room, you'd all feel much more engaged and very bright and focused and able to interact more with your peers, with your cohorts. I was in the San Francisco airport not long ago, long line in the security. I chat a lot, we talked. Guy behind me was going to Tokyo. So, where are you going? What are you doing? I'm going to Tokyo for 18 hours and then I'm coming back. And I'm working for most of those 18 hours, everything scheduled at 15-minute intervals, and I just couldn't believe it. How do you do that? I don't understand. Physiologically, it's impossible. I don't understand. And his response was, we pretend. We pretend to be doing our work. We pretend to be functioning. And again, I was like, my goodness, how would you like it if our pilot on the plane was pretending to be awake enough to go to fly this plane? So it's pervasive, but our culture has embraced sleep deprivation. In fact, our culture pushes us in the direction that says, oh, this sleep. What comes to mind is a sign in Mountain View from a high school placard where on one side it gave the schedule for the final exams. On the other side of that sign, just on the road from Stanford University, Guilleminault, Dement, everyone, on the other side of that sign it said, sleep is for slackers. Can you imagine? So we have a big job to do to push, to change, to challenge the cultural mindset around the need for sleep, the right to sleep, the permission to sleep, and the understanding for what we need. One good thing that has happened is that sleep has increased. We see an increase in the presence in the general news, but people now have glommed on to the idea of I need 8 hours of sleep. So if they're sleeping 6, they're nervous. Or they're looking for, why can't I get my 8 hours of sleep? We have to educate. Again, the theme of education has come up consistently and persistently through the whole day. We have to educate that the total number of hours is affected by how old you are. And we have a normal distribution. There are some people on the face of the planet who do quite well with 5 or 6, maybe 4 hours of sleep. Most people need somewhere between 6, 7, 8, up to 9. There are people on the other tail of that normal distribution that require 10 to 12 hours of sleep in order to feel alert and awake and able to function in their environment. So we have to educate about what is normal. Where are the variations? How can we change things? The key features of sleep is that it's biologic. We share this rest activity need throughout all aspects of biology. Even if you look at the mitochondria, there's data that show, not sleep, of course, because we say sleep, we look at the brain to declare sleep, but even the mitochondria has a rest and activity cycle. Sleep in and of itself is cyclical, and what we mean by that is we need both REM and non-REM sleep. Some of our basic core scientists say that REM sleep is simply that way our body recovers from non-REM sleep. Beautiful, wonderful insights. At this meeting, the World Sleep Meeting, some of our most important, wonderful scientists will be sharing even greater insights. And I mentioned the part about individual differences. We're short sleepers, long sleepers. We prefer to be sleeping at night or as a creature. Oh, thank you. Okay. So there's one. So biological rhythms, non-REM. Okay. Individual differences. There's not enough people learning and teaching and being qualified in sleep. Cornerstones of health. Wake time. Your most important way of attending to your sleep schedule is to pick your favorite wake-up time and to stay with that. That's your most powerful variable in terms of organizing your own sleep. The other critical point is that you are sleeping at the time that is most consistent with the circadian rhythm, with the 24-hour daily rhythm of sleep and wake for yours. So this becomes very important for people who are working shift work, people who travel all the time, people who are challenged with when they have to be awake and functioning. And the amount of sleep is highly individualized. We're not going to do this. Well, the move-ins day. So Malcolm Gladwell, who does a lot for us in terms of bringing science into the general public, talks about 4 essential ingredients. If you want to change something in society, there's 4 essential ingredients. It's the mavens, the people who know the stuff. That's you. That is you. It's the connectors, and we've heard a lot today about how we can connect to our colleagues in other areas and other professionals and in our communities with the schools and other organizations. The context, he mentions an important context for the message that you want to give, and talks about the success of mammography taking off once brochures were put in the hands of hairdressers and barbers, people that already had dentists who have long-term consistent relationship with a large number of people. And stickiness, that's all the marketing. That's like how important is this thing, and how can you reach the people that need to understand what needs to change, those people in positions of power that can help us increase the awareness. What can be more sticky than the health and well-being of our children? So, systems, we don't have time. References, there's lots. This is, again, there's lots. This is stuff in the literature. It's not secret, but what is the challenge is to share this fundamental, critical, important information with anyone who is seeing any person, any child, any patient in a clinical environment. We take blood pressure, we take temperature, we look at heart rate. Why is sleep not another vital sign? How did pain get to be a vital sign and sleep is not? We have to change these things. We're taught to think from a biological, a psychological, and now also social perspective, and one could argue spiritual. We've talked about the importance of biology. If we don't get sleep, we know it affects immediately your psychological performance. And we know socially that homelessness is essentially a challenge of where do you sleep. The most vulnerable of our society need help during their most vulnerable period of time. Peace is only possible when everyone feels safe. And I'm a firm believer that, one of the subtitles of this talk is, world peace through sleep. If we cannot rise to the opportunity of empathy if we don't have sufficient sleep and give people permission. So the way to do that is to be able to prioritize sleep. Again, National Sleep Foundation has said people have agreed, okay, sleep is important, but we have not yet gotten to the point where we actually prioritize sleep, that we think about it as important as eating and moving while breathing, breathing, of course. So, trim tabs. Each one of you is a trim tab. Maybe you don't know the term trim tab, but it comes from aeronautics and aviation. And the trim tab, you see these beautiful cruise ships in the harbor. There's a huge, big ship. How does it move? Huge, big propeller. How does the propeller move? There are all these small, tiny propellers pushing, pushing, pushing to make the big propeller move, to move the big ship. Each one of you can be a critical, important trim tab in your own local environment, reaching out to anybody who will listen about the importance of sleep. So we have to encourage the synergistic collaboration among all of our colleagues. Local tips, one of the most important things is to reach out to your senators. From a spiritual level, we can think of sleep as the yin to the yang of our wakefulness. And I will end there, and thank you very much for your attention and wish you lots of good luck. Thank you.